You know, healthcare continues to be a very hot topic among politicians and the public alike. Well, in Columbia County, we found a place where those in need can get healthcare for free. Free medical clinics are really nothing new, but the modern version actually began during 1967's Summer of Love in San Francisco. That is when Dr. David E. Smith opened the first free clinic in the famed Haight-Ashbury section of that city to service the thousands of young people who gathered there as part of the counterculture movement of the 1960s. That first clinic initially offered substance abuse and mental health treatment due to the amount of drug use going on at the time, but basic health issues such as colds and the flu were also treated. From there, free clinics began to sprout up all across the country to help those with little or no income or who were underinsured or who lacked insurance altogether. The clinics were staffed by volunteers, including doctors and nurses, and funding came through local donations of goods and services or cash. Working under the slogan, "Healthcare is a right, not a privilege," free clinics continue to operate today, including right here in the MetroCast Channel 10 viewing area. The Columbia County Volunteers in Medicine Free Clinic was started just a few years ago as a way to help the working uninsured of Columbia County with their medical issues. Having just accepted patient number 1,000 in December and another 25 cents, it's obvious there is a need for such a facility in this area. Betty Gray, along with a group of friends and volunteers, spearheaded the push to open the clinic, and she is now the clinic's director.
It got started because in 2003 my husband lost his job, and that meant we had no health insurance. I was in dire need of a surgery, and fortunately I had been working at a hospital and could get COBRA. But as I was recovering, I thought about all the women that had the same type of issue that I had, needing the surgery that I needed. And while I was recovering, one night I was watching ABC's 2020, and John Bon Jovi was dedicating a clinic in Red Bank, New Jersey, and it was a volunteers in medicine clinic there. So I went online and I typed in volunteers in medicine, and next thing I know there's a woman calling me and saying, "Hey, you want to start a free medical clinic?" And I'm like, I don't know about that, but so that's really how it got started.
What Betty found out was that she wasn't alone concerning health insurance coverage issues, and that there was a growing need for a community-based health clinic that could offer help to those with jobs but without health insurance.
The clinic is for the working uninsured and now the unemployed, because for a lot of times they were like me. They would have to buy COBRA, which means they can't afford that. And we cover Columbia, Montour, and southern Luzerne counties. Working uninsured means that maybe you're working a part-time job, maybe you're working a full-time job, maybe you're working 3 or 4 part-time jobs. That's what it means. And have no insurance at all. No medical assistance, no Medicare, nothing like that. No private insurance.
Those who take the clinic up on its offer of free health care find it offers almost everything a regular doctor's office does.
We're a primary care practice, which means that we provide any type of service that you would find in a primary care office. We do physicals for work, for people that need to keep working, to keep their job, they need a physical. We do colds, sore throats, we run the gamut. We see diabetics, we see people with high blood pressure, the whole 9 yards. We treat anybody over the age of 18. We don't do pediatrics. We do like tuberculosis screenings. We do flu vaccines, pneumonia vaccines, and generally we don't take emergency room. If anything, we try to tell people, if you're having shortness of breath or you can't breathe or your chest pain, please go to the emergency room. That's what the emergency rooms are for. Here, I don't want to say we see the run-of-the-mill things, because we never know for sure what we're going to have coming through the door. Even though people make appointments, they may tell you, "Oh, I have a cold," but end up coming with, a variety of different things that you don't know about. But no, we're not an emergency room.
As far as the health care provided, doctors, nurses, and other trained medical professionals volunteer their services at various times during the week.
We started out originally with a lot of volunteers, and we still use volunteers. We volunteer physicians, volunteer nurses, volunteer clerical staff. Anybody that you could think of that could volunteer here, we've welcomed. Volunteers are coming from Berwick, Bloomsburg. They're coming from Geisinger. They can be in family practice. They can be specialty. For the most part, if you can practice medicine and you're a physician and you have a state license, physician assistants are also welcome. We will take any help we can get. The more volunteers we get, the more hours we can be open.
And patients will be glad to know that confidentiality laws do apply to the clinic.
But confidentiality is key. We're just like any place else. We don't go out in the street and say, "Oh, Joe Schmo was here and he's using the free clinic." We know that the patients come through here have great sense of pride, and that they don't really, it takes a lot for a lot of people to walk through the doors. It really does, because I've talked to a lot of the patients. So we make sure that confidentiality is no different than if you walked into, Geisinger or, Berwick Hospital or any of the local physician offices. We have charts, we actually have like computers where we can type our notes in, and then we're connected in with Geisinger Connect, so we can pull out medical information. We've joined what's called Keystone Health Information Exchange, which will allow us to access patients' records for any hospital that they go to, which for me is huge because of continuity of care. The health electronic records are huge.
We follow up on people with phone calls. Some of our different chronic illnesses we follow up regularly, weekly with phone calls, and make sure they went to their appointment, and if they didn't, why, and what can we do to schedule you a new one, or what, we really try to make sure that they're doing what we've suggested.
Located in Mifflinville along Route 339, the Columbia County Volunteers in Medicine Clinic now has over 1,000 patients, which Betty says is pretty amazing considering they only opened their doors 4 years ago.
When we first started, we actually started in Berwick, and the first night when we started on Market Street, and the first night we had 10 patients and 5 seats in the waiting room. So after a few weeks, we knew that was not going to work out. So that's how we ended up in Mifflinville. Basically, we had every Thursday night, and we did that for probably many Thursday nights until one of the local docs said, hey, I can't do Thursday night, how about if I do Wednesday night? So he's been coming ever since on a Wednesday night once a month. And then one of the physician assistants said, well, it's pretty hectic for me during the week because of my family, how about if I do a Saturday morning? So we've been able to do a Saturday morning like once a month. We got some grant money from the Health and Wellness Fund, Berwick Health and Wellness, and that's actually allowed us to hire a nurse, a physician assistant, and a receptionist that can help close the gaps. So now we're open a little bit more.
You were a patient here at first.
That is correct.
Tell me about that.
I was working, didn't have coverage for health insurance, heard about the clinic through a friend and decided I'd come down, and found it was very interesting because it was a place where you felt at home right away. They were very warm, very welcoming. The doctor spent a lot of time with you. I wasn't quite used to that, so it was very nice because you could really get a chance to talk to the doctor. You really felt at home here.
My experiences here have been enlightening. There's a lot of people out there without health insurance, and it's surprising how many. And some of them are working 2 jobs trying to make ends meet, and they're still not able to afford health insurance.
I was part of the clinic from the beginning 3 years ago, and was a volunteer, and saw the actual need for care in this area for the working uninsured, and it just gives you a lot of satisfaction. You get a lot of satisfaction from helping people who otherwise feel as though they don't deserve the care, they can't afford the care, and are just too proud to ask.
Other local charitable organizations have also come forward to offer their assistance to the clinic, either through their time or with cash donations. For instance, the former Berwick Hospital gift shop has become the Berwick Volunteers in Philanthropy organization, and they presented Betty and the clinic with a check while we were there.
We're giving money to the clinic because we realize what a fantastic work that they're doing. We've kept our eye on them from the very beginning, and I know Betty from way back. So I know her heart is always in service for the community. I think the service is fantastic. Being a former active nurse in the Berwick Hospital, I realize the need in this community for people who need this kind of care and who couldn't get it otherwise.
In addition to health care, the clinic has begun to operate as an overall human resources center, including as a small food bank.
Yes, all the way around. LIHEAP, food, social services. We're not only, I think, anymore a primary medical clinic, but we're all about the human aspect of everything. We actually have a little food cupboard in the clinic. Way back when, I found that one of the diabetics, when talking to the diabetic, said, oh, I'm eating dog food. And it started to make me think like, well, if that person's eating dog food, how many more patients do we have that don't have food? And we have gone through pounds and pounds and pounds of food, because the patients will come in and they'll take a look around and they'll see, and sometimes they don't want to take the food because they think, oh, it's not, you know, it's always for somebody else. You know, I'm okay. But when you start to really talk to them, they're working and the ends aren't meeting.
And staff members say the reaction of patients who have received care from the clinic runs a gamut of emotions.
Most people are humbled by the experience, and they think there's actually people here that care, and they just can't believe that because they haven't had that reception otherwise in the outside world. And people are coming back more easily and calling us more easily because they know that we care.
Usually they're very appreciative. They're surprised sometimes at what they see when they come in the door, because they expect it to be, I think, almost a rundown shack, shabbily run kind of thing. When you hear free, you think something like health insurance that costly, healthcare being that costly. They think it's, it can't be a good place to go but I think they're very pleasantly surprised.
I think that everybody comes in a little apprehensive, thinking, okay, I'm going to be shuffled through. No one's really going to care about me. I think that after they come in, they find out how we are and how the doctors are and how willing everyone is to help, how every step of the way, no matter if it's just a doctor's appointment, if it's lab work, if it's a counseling session, whatever they need, we will do our best to help whatever direction they need. So by the time they leave, they came in as a patient, pretty much they leave as a friend.
People are hurting and people don't have medical care. And the more people that don't have medical care as we go on, the worse it's going to be. The problem is that a lot of times when the patients come through, they're a whole lot sicker than what they may call you with one ailment, but when they get in the door, you really find out how really sick they are. And that brings me up to the point in almost 4 years, we've had 34 cancers. Diabetics with blood sugars 700-800, hypertension, if normal is 120/70, these people have 180/120, and they're walking around, they're working every day. They don't realize how sick they are. And the big thing is that they're human beings. And these are the people that are in the crack. They don't qualify for medical assistance. They may be 25 or 30 bucks over, but they can come here and they can get services and be seen. But I can tell you that it's nasty and it's only getting worse. It's not getting better. When we started the 5 or 10 patients a week, we thought we were doing good. To know that we have added 25 new patients in just 2 weeks or 3 weeks, that's incredible for a small area like us. I mean, just incredible. And I don't know how to change it. Healthcare reform is so big, and with the repealing of healthcare reform, or what they think they want to repeal, I don't know. I think that down the road, we may be much, much more busy than what we are now.
It is a very neat and orderly free clinic. That, again, is for the working uninsured or even the unemployed right now in Columbia and Montour counties, as well as portions of southern Luzerne County. Hours of operation vary, and office visits are by appointment only, so you do need to call. And also, income guidelines must be met. Again, you need to call. The website and the phone number are on your screen. Also, if you are interested in starting a Volunteers in Medicine clinic in your area, the national website's a great place to get started. That information's on your screen as well. By the way, there are over 70 Volunteers in Medicine clinics operating currently in 22 states all across America. That does it for this episode. We thank you so much for watching, and we'll see you again after later.